Among the crowded early field of 9 Massachusetts gubernatorial candidates, there are 2 medical doctors, 3 others from traditional political backgrounds who have served in government, 1 former healthcare insurance executive, 1 venture capitalist, and 1 small business owner. Their different backgrounds have produced a range of different ideas and solutions for the challenges facing the Commonwealth. One of the most hotly debated topics is healthcare. All the candidates believe the system needs to be reformed, but each has his or her own plan to make it more effective, from lowering costs, preventing chronic illnesses through early detection, and improving access to quality care. Democratic candidate Don Berwick, president of the Harvard Community Health Plan and co-founder of the Institute for Healthcare Improvement, believes that preventing illness and disease will lead to the most effective healthcare system.
Prevention is key, 400% more important in determining our health. More important than health care is how we lead our lives, exercise and nutrition and threats in our environment, poverty itself, injustice. These are threats. So we have to get reoriented toward continuity in chronic illness care and prevention. We can do it.
Both Democrat Juliette Kayyem and Republican Charlie Baker would reform the system through transparency. Kayyem has worked for both the Patrick and Obama administrations as a security expert. While her expertise does not lie in healthcare, she's a strong advocate of being prepared for what's to come and believes healthcare must be standardized. Baker, a former health insurance executive, calls for more transparency in order to make sure everyone is equal.
I think a huge issue is transparency. Why one kid goes here and it costs this much and another kid goes there and I'm fully insured. There has got to be transparency to the process. I have learned a lot from a lot of the ingenuity going on in our state in terms of quality of care, preventative care, focusing on elevating primary care physicians in a lot of our communities because that can reduce the cost. Third, there are a few diseases that are the burden on our on our health system. And we need to start talking about public health as actually a hard issue.
I definitely think we need more transparency, bigger investment in primary care, and we need to take out a lot of the non-value-added administrivia that exists in the system now, which if you talk to anybody who works in it, I think even a lot of the people who are engaged in the regulatory activities will talk to you about that.
State Treasurer Steve Grossman and Attorney General Martha Coakley both believe the heart of the healthcare problem lies within the high costs.
I think having healthy community hospitals is an important ingredient in providing the kind of lower cost but still high quality health care that we need. People want to make sure that their health care is available to them, i.e. accessible. They want to make sure that it's of high quality, and we need to make it more affordable.
We have made great progress in Massachusetts in providing access in quality health care for everybody. We also need to continue our fight to keep those health care costs down.
Democratic candidate Joe Avallone has experience working in the healthcare system. In the 1990s, he served as the chief operating officer of Blue Cross Blue Shield and worked to control healthcare costs. Evan Falchuk, United Independent Party candidate, has worked with the Boston Best Doctors Incorporated for 15 years, acquiring skills that make him familiar with the healthcare system. Both believe managing payments is the most effective way to reform the healthcare system.
Well, we need to move our delivery system towards larger groups of physicians, coordinating care so that they operate in teams to take a holistic view of the patient, and as a group manage a population of patients. And secondly, we have to move away from fee-for-service payment, which the payers use, both public and private payers, which rewards quantity versus quality. Fee-for-service payment means doctors get paid for everything they do, and that means that they are pushed to see more patients in less time, and they're also pushed to do more procedures, often at the back end of a disease process. By changing the payment towards one that rewards quality of outcomes, it'll encourage our doctor groups to spend more time and money on preventive medicine and early intervention, which we know has a huge payoff in lower mortality and morbidity for our patients and lower cost overall for the health system.
My view is what we'll do in a Falchuk administration about this issue is to stop those mergers from happening and to do what other states have done. We've fallen behind. Other states like Maryland have created a rational, fair, equitable fee schedule for hospital services that can take out some of that excess cost in hospital care.
Independent candidate Jeff McCormick, founder of the Boston venture capitalist firm Saturn Partners, believes investing in primary care will be the most effective way to cut costs by catching chronic diseases while they are still treatable.
Investing in primary care is going to pay for itself many times over because of what that does for chronic diseases. There's something called shared preferences or patient preferences, which is also important, to have an active dialogue with a patient to make sure he or she is fully informed as to what the options are and what the best course of action is for that particular patient.
Tea Party candidate Mark Fisher calls for a free market where the government does not play a role in healthcare. He believes that the current system does not work because of government involvement.
I don't believe the free market has played out here in Massachusetts with regard to healthcare. It's a government-sponsored thing. I mean, when the free market played out with regard to auto insurance, when Geico and Allstate and Progressive were allowed to come in, we all shared the benefits. Our premiums went down by about 13%. Let's do that across state lines with healthcare. We can't do that across state lines here in healthcare in Massachusetts. When our government-sponsored health insurance went into place, it was said that we would save premiums. The cost would go down. We have the highest premiums in the whole country, by more than 15 or 20% above the rest of the country. If we hadn't done anything, I think it'd be down to the level of the rest of the country. That's because it's been government-sponsored.
Another important issue facing the state is jobs. Don Berwick, who ran the biggest federal agency as the head of the nation's Medicare and Medicaid program, believes the key to more jobs is to help small businesses start entrepreneurial programs that train their workers right away.
It can be done with investment in entrepreneurship. This state has a pretty good set of programs now in biotechnology and other areas supporting small entrepreneurs to get started. I would do more of that, and I think we can learn from other states that are doing this, in some cases, even better than we are. But a little bit of money can go a long way in helping a person get started.
Another potential solution is creating jobs in new industries. Joe Avalone and Martha Coakley believe that green technology and telecommunications are areas where more jobs can be created.
Our future is jobs, thousands of jobs throughout our state. But we're not going to create jobs with business as usual or politics as usual. We're entering a new century, and with a new century comes new industries. But Massachusetts must adapt. Tens of thousands of jobs can come from these new industries around our state. New jobs based on precision manufacturing or smart manufacturing, life sciences, healthcare itself, telecommunications, IT, alternative energy. Thousands of jobs can come here.
We need to make sure that we tool for our basic education, but also our workforce training, where those jobs are going to be. In Massachusetts, we have a lot of growth. We also have jobs unfilled, and we have unemployment on the other end. We need to do a better alignment. I think talking to private industry about where those jobs will come from, because I think we can see a job growth, as we just mentioned, in the green technology area. That's been a great producer of jobs. And we can, if we work better in our schools with our workforce investment boards, for instance, across the state, and with the private sector to say, what do people need to know to do those jobs?
Steve Grossman believes the best way to create jobs is to start when potential employees are still in school. He wants to work with vocational technical schools and community colleges to train students to be successful in their job fields.
If we can bring those jobs back to Chicopee and Holyoke and Springfield and Greenfield and Athol and Orange and the places where manufacturing is part of the history of those communities, and use our vocational technical schools and our community colleges wisely, working with local employment boards, that to me is a prescription for creating jobs and educated workforce to take those jobs and build the kind of middle-class incomes that will enable them to bring up a family and have the quality of life that they aspire to.
Charlie Baker believes the best way to create more jobs is by making state government more affordable, accountable, and business-friendly. He also believes the root of the jobs problem comes from the broken healthcare system. Baker explains that by fixing businesses' concerns over healthcare costs for their employees, they will be more willing to hire.
Small business being where most of that job and economic opportunity comes from, the cost of healthcare is like 1, 2, or 2A on all of their lists of the things that they worry the most about with respect to growing and creating more jobs in Massachusetts. And for most of them, The federal overlay on healthcare reform is going to make their cost of healthcare more expensive, not less expensive.
Mark Fisher is an advocate of changing the corporate tax rate. In addition, he suggests potentially removing the inventory tax rate that prevents employers from hiring more workers.
Here's the things that I think we can do to bring jobs back to Massachusetts. We take a look at our corporate tax rate, and I'm not saying lower it to a specific number. I'm saying let's look at the states that these businesses are going to, and let's make it comparable to where they're going. The second thing is, let's get rid of the overburdensome rules and regulations, and they are overburdensome. Let's also stop taking taxpayer dollars and funding fad industries, like Evergreen Solar out in Devons. The last step, there's an inventory tax in Massachusetts. If we eliminate the inventory tax, we become a haven for distribution centers.
All of the candidates agree to the principle that the future of Massachusetts lies in its education system. 4 out of the 9 candidates believe that vocational technical schools and community colleges are the key to a thriving economy and workforce.
Companies will go where the workforce is, and they will go where the work skills are that will serve their needs. So we have to make sure that every community college, every state college, and our vocational schools have these critical work skills that set our young people up for success. That every high school diploma has value. And that we continue to support our vocational schools so that the thousands of young people that are going through them and go on to good lives can have good jobs, good paying jobs, and support a family.
We need to engage the leadership of our educational institutions, particularly our vocational technical schools. There are 64 of them in Massachusetts, so that they're actually teaching the things that young people, when they graduate from vocational technical school, perhaps go on to the community college, even for a 4-year degree, need.
Early childhood education is extremely important, but we also need to invest in vocational training. We need to invest in community colleges, and we also need to heavily invest in state colleges. Why? 85% of those graduates stay in state. They are our future entrepreneurs.
I don't think we have focused enough on those jobs that don't require a college education. After this meeting, I'm talking with a Globe reporter, and they're talking about a program with a local trade school and how it partners with a college. Oh my goodness. I went to a community college, but the people who go to trade school, I'm trying to find them. I'm trying to hire them at my work, and I can't find them.
Charlie Baker and Martha Coakley are more concerned with making sure every student that wants to attend school has the opportunity to do so.
I don't think Massachusetts can be a truly great state unless everybody who wants to work can. Every kid can get up and go to a school where they believe they're getting the kind of education that's going to prepare them for the future. And every community is a safe, thriving community in which people believe that the future is as great and as significant an opportunity as anything that happened in the past.
In order to make sure that we turn this economy around for everybody, the second thing we need to do is make sure that in our education and our workforce development, we give everybody an opportunity to get the best education that he or she wants, is entitled to, so that they can fully participate in a global economy.
Don Berwick believes that great students come from great teachers. He wants to make sure all teachers have proper training and can demonstrate that they can meet important teaching criteria.
We need some standards. We need some standard testing. We need that. We need to know how our schools are doing. But if I had to pick one thing in education, it's returning to the development of the pride and the joy and the competence and the skill of the teacher workforces. It is the only pathway that I know to successful education for young people. And that means giving teachers opportunities to learn, to grow together, investing in them. We see at work.
Evan Falchuk wants more emphasis on the creative arts in order for students to become well-rounded individuals.
I think that one of the areas that we do not see enough emphasis on in our education is the creative arts. So simple things like drawing, playing an instrument, acting, singing. As you can't put a metric on exactly the impact that has on a kid's life, but awakening that creative impulse in his brain is exactly the thing that our students need to have done.
The Democratic Convention will be held in June and will eliminate a few of the candidates. In order to remain on the ballot, candidates must receive 15% of the votes. So far, the most likely candidates are Coakley and Grossman, who hold onto their lead in the polls. Charlie Baker received the Republican nomination, but Mark Fisher has challenged the calculation of votes. The primary elections will be held in September, and the final election will be in November.